Good afternoon, everyone, and thank you so much for joining us as we officially introduce the Medicare for All Act of 2021. My name is Congresswoman Pramila Jayapal. I am one of the lead sponsors of the bill, and I am the chair of the Congressional Progressive Caucus. Last Congress, I was so proud to introduce the most progressive, comprehensive, battle-ready Medicare for All bill into the House of Representatives with my co-lead, Representative Debbie Dingell. Our 125-page Medicare for All bill lays out a detailed blueprint on how we can transform the healthcare system into one that finally guarantees healthcare to everyone as a human right. Healthcare with comprehensive benefits like long-term care. Healthcare without copays, private insurance premiums, deductibles, and other out-of-pocket costs. And today, we are introducing the bill with even more co-sponsors than we had when we introduced it in the last Congress. I am so excited to share that we have over half of the House Democratic Caucus signed on, including 14 committee chairs and a number of key leadership members. We also have amongst those committee chairs, Chairman Frank Pallone of the powerful Energy and Commerce Committee, who has just also committed to holding a hearing on Medicare for All. Chairman Pallone was not on the bill last Congress, but we're so glad to welcome him this time, along with two members that weren't on the bill last time, but are this time, that you'll hear from, Representative Tony Cardenas and Representative Ted Deutsch. As we continue our inside-outside organizing strategy alongside so many of the advocates joining us today, these co-sponsors are in addition to the endorsement of over 300 local, state, and national organizations that represent nurses, doctors, business owners, labor unions, and racial justice organizations, more than we have ever had before. Our movement is growing. We are joining together at this pivotal moment for healthcare across America. It was exactly 1 year ago that every single state across this country had a confirmed COVID-19 case. And in the 365 days since, the case for Medicare for All has never been clearer. The pandemic has taken the lives of over 538,000 people. It has devastated our communities. It has left too many with surprise bills. And millions of Americans have lost their health insurance altogether simply because they lost their jobs. And though this devastating pandemic has shone a bright light on our broken for-profit healthcare system, we also know that we were already leaving nearly half of all adults under the age of 65 uninsured or underinsured before COVID-19 hit. And that was happening while we paid double more per capita for healthcare than any other country in the world. When I recently asked what Medicare for All would mean for people, I was overwhelmed by thousands of simple but heartbreaking responses. Things like, my daughters who have no employer benefits would actually be able to seek care when they are sick, get prescriptions when they need them, and not live in fear of the next illness. Or, my kids could be kids. I wouldn't have to be overly cautious because something as simple as a broken arm could set us back financially. Or a doctor who said, I could look into my patient's eyes and tell them that I can truly care for them. Knowing that you have healthcare changes everything about us, how we look and act in the world, what choices we make, whether or not we start a new business, whether or not we take a job we really love instead of one that we don't love, but we take it because at least it's got some healthcare. Medicare for All would be life-changing for tens of millions of people. That's why what we're doing today is so critical. If we had had Medicare for All in place, I am convinced that we would not have lost so many lives and we would not have had so many people get sick with COVID-19. We have to continue building our national grassroots movement to be even stronger than before so we can pass Medicare for All in Congress. This Congress is a major opportunity to push forward the legislative groundwork for Medicare for All while continuing to build at the grassroots the demand for a fundamental shift in our healthcare system. Alongside all of you, I am going to hold President Biden and his administration's feet to the fire as we continue to build our support for Medicare for All in the House and across the country. And that means relying on all of you to be fighting alongside us inside and outside, every step of the way. I know that for too many of us, the fight for Medicare for All is deeply personal. Too many of us have a loved one who's been denied the right to healthcare. Too many have had to cut pills because prescriptions were too expensive. Too many have had to make impossible decisions between paying their rent or paying a hospital bill. And despite the formidable barriers that have been put in the way by the for-profit healthcare industry, our growing Medicare for All movement is committed to marching onward, to being courageous, and to holding a powerful vision of what we can achieve together. Because let us never forget that there is a solution to this healthcare crisis in America, a popular one that guarantees healthcare to every person as a human right, a solution that transforms our healthcare system into one that prioritizes patients over profits and care over corporations, and by the way, is a lot more affordable than what we have today. That solution is Medicare for All. Everyone in, nobody out. And I am so proud to once again be able to introduce it alongside all of my amazing colleagues that you'll hear from today and alongside all of you. So for everyone watching today, thank you so much for joining us. Thank you for making all of this possible. Thank you for being a voice for so many and organizing in your communities. Let's keep that drumbeat going in every community across the country and keep up our fight for Medicare for All. And with that, it is my great honor to introduce my co-lead for Medicare for All, my co-chair of the Medicare for All caucus here in Congress, and my co-conspirator in all things Medicare for All, Representative Debbie Dingell.
Thank you, Pramila, and it is an honor to be with you. All the hard work that you have put into this, your intensity and your passion, I'm so grateful for. And together, working with all of our colleagues who mean so much to us, and we're so proud to be here with you today. The time is now, and we are going to get this done. You know, people don't realize, first of all, I didn't realize how broken the system was until I became a caregiver. And I'm supposed to be able to navigate this system. And the days that I would be in total tears, pounding my head against a wall, trying to make a system work, was an educational experience in and of itself. And now that we have been through COVID, we have seen the fractures in our healthcare system. And even people who knew we needed Medicare for All have just seen it in such very stark circumstances. Nearly 30 million Americans are uninsured, and at least 40 million Americans can't afford the cost of their copays or their deductibles. The quality of our healthcare is worse than in any other industrialized nation. We spend more per capita than anybody. Our life expectancy in the US is lower than most other nations, many third world countries, and our infant mortality rate is higher. And we are the only industrialized country in the world that does not guarantee all of its citizens healthcare, access to healthcare. So, you know, I'm a car girl. Or I'll go to Republican language. We're competing in a global marketplace where we are at a competitive disadvantage in this country because the governments of Germany, Japan, and the other car makers cover healthcare, and our companies have to pay for that. We need healthcare for all. We waste hundreds of billions of dollars every year on unnecessary administrative costs, and a lot of people are making too much profit on patient care. Our current healthcare system in the United States is ineffective, inefficient, and outrageously expensive. And it is time. You know, this is a very personal issue to me. Many of you, and it's fabulous to be on here, not only with my colleagues, but with so many of the nonprofits and the advocacy groups that I have worked on. My father-in-law was one of the authors of Social Security. And when Social Security was passed, people called him a socialist. They called him a communist. They burnt crosses on his lawn. And does anybody think that now about Social Security? And it took a long time to get Medicare passed. It immediately got introduced by somebody who may have had the last name Dingell after Social Security passed, and it got passed in 65. Now, this country has seen the ravages of COVID-19, the fractures in our healthcare system, and the time is now for Medicare for all. And I have confidence that with all of my colleagues here, with how the American people feel, the desperateness, the parents who are, Pramila talked about them in such eloquent words, that are afraid that they have to choose between a roof over their head or food on the table or taking their child to a doctor. And the story that's not left my heart was a senior that I checked on early in the COVID pandemic who said to me, I can't get COVID. They've already made a decision that I could die. They've decided it's too expensive to take care of me. So I'm disposable to this country. No senior should ever feel that they're disposable. It's time. And I look forward to working with everybody that's on this call, that's listening, to make sure we get the momentum to get this done once and for all. And with that, I think I turn it back to you, Pramila, and you introduce our next speaker.
Well, actually, we're just going to have members introduce the next member, but I'm happy to introduce my really good friend and the chairman of the House Rules Committee, where we did our first hearing, who has been such a champion of Medicare for All and presided over an amazing hearing, Chairman Jim McGovern.
Well, thank you, Pramila. Thank you for your friendship, leadership, and for all that you do. Debbie and all my colleagues, I'm so grateful to be with you. Special shout out to my friend Eric Dixon, who's the president and CEO of UMass Memorial Healthcare System in Worcester, Massachusetts. Great to see you here. Look, everybody, this is not a radical idea. We all get sick. We all need to go to the doctor or get a test or fill a prescription. All we're saying is that nobody's first thought when they get sick should be, how can I afford it? We're saying that in the richest country in the history of the world, there is no good reason not to have universal health care. Health care ought to be a fundamental human right for every single person in this country. You know, some people come from a family of doctors. I like to say I come from a family of patients, and patients who have very complicated medical histories. My dad, who recently passed away, had a lot of medical issues over his lifetime. And even with good health insurance, he still had to pay an awful lot of money in out-of-pocket expenses over the years. I have seen how this issue can put a huge financial strain on families at a very difficult time. But it doesn't have to be like that. Your first thought when you get sick should be, how am I going to get better? Not how am I going to pay for it, or am I going to be able to get access to a good doctor? I'm proud that as chairman of the Rules Committee, I held the first ever hearing on Medicare for All in Congress, thanks in large part to Pramila's leadership. And what we heard during that hearing, quite frankly, was outrageous. Adi Barkan, who is a hero of mine, who has ALS and advocates for Medicare for All, literally had to go use a GoFundMe page to pay for his health care. I mean, are you kidding me? Is this the best that we can do in the United States of America? I mean, give me a break. And just one final thing, even if you disagree with us and you don't believe that everyone deserves good health care, which you should, but even if you don't, the reality is that this is smart policy too. Over the next decade, Americans are going to pay out trillions and trillions of dollars in out-of-pocket expenses. And our idea is very simple. That the money our country spends on healthcare should not go to insurance company CEOs. In a country where we have billionaires and Fortune 500 companies that pay nothing in taxes, it is a huge, disgraceful policy failure that everyday people cannot afford prescription drugs or to visit their doctor. So here's the deal. We are going to keep fighting for this. We're going to keep fighting for this because now is the time. This pandemic has exposed the inequities of the system as it exists, and we need to fight like hell for Medicare for all. It is popular, it is smart, and it is the right thing to do. And now I have the honor to introduce Congressman Matt Cartwright of Pennsylvania, chairman of the powerful Commerce, Justice, and Science Subcommittee of the Appropriations Committee, and another tireless leader on this issue. So, Matt, I turn it over to you.
Thank you, Mr. Chairman. Thank you, Jim. And thanks also to Pramila and Debbie for leading this effort in the House. I've been a co-sponsor of Medicare for All for a number of Congresses now, and I'm not afraid to tell anybody that. And I tell them that as a card-carrying capitalist. My slant on it is this. I first became interested in Medicare for All because of a group of businessmen who approached me, led by a fellow named Richard Master, who has become a very close friend of mine. And he said this, look, Matt, you understand, you were an employer. I was an employer for 25 years as the leader of a law firm. We had a couple of dozen employees, and we gave all of them health care. That was an important benefit to them. And year after year, starting around 2000, maybe a little bit earlier, we were looking at annual increases of 17%, 20%, 25%. One year it was a 40% increase in our premiums to give health care to our employees. And so you end up having to look your employees in the eye at the end of the year and say, you know, Sam, I can't give you a raise for next year. Your health care went up so much. And you think, well, did the quality of health care go up that much? You know, were they availing themselves of health care more than ever? None of that was true. We knew it was the enormous inefficiency in the way it's delivered in this country. And Richard Masters said to me, look, why are we paying for all of this administrative overhead from one for-profit healthcare insurance company to the next? Look at Medicare. You're talking about a 3% administrative expense. Medicare doesn't have executives jetting from one place to another with big salaries and big benefits and big golden parachutes. They don't have that. They don't have, there's no such thing as the Medicare Open golf tournament. They don't waste money at Medicare. They process claims efficiently and they get healthcare providers paid. And so if we can right off the bat save something like 20%, maybe more of our healthcare bite every year just because everybody's covered under Medicare, an efficiently run program, wouldn't that mean for much lower healthcare premiums for employers? Richard Master, this businessman, very enormously successful businessman, has been really leading an effort to push Medicare for all. Talked me into it. And I went on Fox News and I gave the business pitch for Medicare for all. And I was proud to do it. I'll do it again. So thank you for this effort. We'll continue to push and get more and more co-sponsors. And now I want to turn it over to my great colleague, Antonio Cardenas. Tony Cardenas is a phenomenal congressman. We came in together. He's been in politics a lot longer than I have. He's been fighting for ordinary working people the majority of his adult life in the California State Assembly, in the Los Angeles City Council. By training, he is an electrical engineer, of all things. But he has made himself a force to be reckoned with on the Energy and Commerce Committee. He's the vice chair of the Consumer Protection Subcommittee. What a perfect place for a warrior for the regular working people. Tony Cardenas, take it away.
Thank you very much, Matt, and really appreciate this opportunity to be together with all of you and to express how important it is for every person in America to be able to exercise the right to have healthcare, the right to be able to access a doctor and to get the assistance they need when they need it. To Congresswoman Jayapal, thank you for your tenacious effort and work. And to my colleague, Debbie Dingell, you've been amazing. My car friend on the Energy and Commerce Committee. And it's been wonderful to see so many of us come together from all different parts of the country, from all different elements of what makes us who we are. And what makes me who I am is being the son of immigrants and parents with a first and second grade education who came to this country and decided that they were going to raise a family here. And boy, did they raise a family. There's 11 of us, and I'm number 11. When I was the last one to be born, I knew my father as a self-employed gardener. For God's sakes, in the 1960s and 70s, for somebody to be able to pay for insurance for 13 people, the chart wouldn't even go that far. So we went without. And therefore, when we got sick, it was a prayer and aspirin. And then you just waited. If the fever got way too high, then we went to the emergency room. My parents literally thought that we were going to die, then we went to the emergency room. That still happens today, ladies and gentlemen, in the greatest nation in the world. How can we call ourselves great when hard-working people? My father never worked less than 60 hours a week his entire adult life. Yet at the same time, even though he could provide food and shelter, he couldn't provide healthcare for his children in the greatest nation on the planet. It's time that we fix what ails our country. What ails the United States of America is just the will to do the right thing. The will to look certain interests in the eye and say, if you want to participate in a just and true system, then go ahead and participate, but do it in an honest way. Don't do it in a way where you're looking at profits first and not looking at people first. Do it in a way where you're actually participating and you can make great products. You can provide healthcare for people. You can be proud of what you do instead of just saying, no, I'm going to game the system in a way that I just look at profits first and I don't worry about how many millions of children, how many millions of single mothers, how many millions of people are sitting there praying that they don't get sick, praying that something doesn't happen because they cannot afford to see a doctor. My father was a gardener when I knew him growing up. He was a self-employed gardener, but before that, when he came to this country, he was a farm worker and then was a construction worker, always proud to work hard, always worked with his shoulders and his back and do everything that he can to feed his family. But when he was a self-employed gardener, we went without health insurance. And that should never happen to anyone. And it's happening to millions and millions of families, millions of children every single year. And that has to stop. And Medicare for all is the answer. And it's an opportunity for us in Congress to advance this forward and to bring it to the president so we can bring into a new age of the United States of America where we can truly say we are great when we take care of everyone, when everyone has the opportunity not to fret over getting sick, but to know that they can, in fact, see and seek the help that they deserve and need as human beings. It's a dignity issue, ladies and gentlemen. That's what it comes down to. And it's now my pleasure and my honor to introduce one of the most tenacious individuals in Congress, someone who brings her heart and soul into everything that she does. One of the most beautiful people in Congress and in this country, someone who knows that this country is great and it's diverse and it's amazing and it's awesome and we all should be treated as equals and we all should have access to healthcare. And that's my friend and colleague from Michigan, Rashida Tlaib.
Thank you so much, Tony, for that unbelievable introduction. I'm the eldest of 14, so we should talk. But I'm proud of my UAW father who, with only fourth grade education, was able to start a Ford Motor Company. And because of unions, because there was the power to organize, he was able to access healthcare. So thank you so much again to my good colleague from California. Good afternoon to all of you. Thank you to my double trouble Michigan partner, Congresswoman Debbie Dingell, who has not stopped engaging our labor leaders, our labor organizations throughout Michigan, who really are the forefront in transforming what we can do with our healthcare system. And of course, my sister, Amelia Jayapal, who I've known for over a decade, admired her continually for years as a member of the legislature in Washington, and now as the United States Congresswoman and our wonderful chair and leader of the Congressional Progressive Caucus. Both of you are helping push for change that saves lives. Please don't underestimate that. And I thank you again on behalf of the millions who desperately need this today. We are failing our neighbors in the United States by allowing corporate greed schemes, which I also call private industry insurance, to deprive our sick neighbors of access to adequate health care. I represent portions of Wayne County in Michigan, where 1 in 5 of my residents are in poor or fair health. In Wayne County, we saw more than 7,000 preventable hospital stays per 100,000 people in 2017. Medicare for All would turn this around. Our current system is subjecting our neighbors. We all have seen it, especially our communities of color, to undue harm and death. Implementing Medicare for All would bring endless opportunities, well-being, and improved quality of life to many of our neighbors. It's more affordable, more equitable, and more accessible way to deliver healthcare and coverage in the United States. I receive a call all the time, emails, letters from residents demanding that we do something transformative for our healthcare. Medical bills right now contribute to more than 60% of all bankruptcies. 3/4 of our neighbors, those that have filed bankruptcy, is due to the fact that they lacked health insurance at a time that they were actually sick. People are being forced into poverty and are dying because we have not said enough in putting profits before our people. We have allowed the corporate schemes, allowed the private insurance industry to gaslight our colleagues to believe, quote, doing nothing is the right approach. Well, today we are saying that with the reintroduction of the Medicare for All Act, that we're saying enough, we're not going to wait anymore. Our families have been waiting too long. Today, we are saying during a global public health crisis that we must have comprehensive health care coverage for all. Today, we are making it clear that Medicare for All is a path forward, and we are done with the do nothing approach. We will stop corporate greed schemes from killing our neighbors. And with that, I had the honor to introducing my new colleague from the wonderful state of Georgia, who continues to work to ensure our marginalized communities have access to healthcare, and who helped deliver Georgia for the nation. I am so proud of her. I'm proud to introduce my sister in service, Congresswoman Nikema Williams.
Thank you so much, Congresswoman Tlaib. I am grateful to be here in Congress and to have all of you working with us to make sure that we bring true justice for everyone in this country. Y'all, I am excited to be a co-sponsor of the reintroduction of the Medicare for All Act to ensure that everyone receives health care. High quality health care should not be dependent on individuals' employers' ability to provide insurance, and the loss of a job shouldn't affect someone's coverage. I know the failures of our healthcare system all too well because I live them. I know what it's like to have to refuse needed emergency care because you can't afford it. In 2017, while running for the state Senate, I didn't have health insurance and I was in a car accident. After the accident, I sat on the side of the road with visible seatbelt burns and bruising from the airbags, but I declined to be transported by ambulance that day because I knew I didn't have health insurance and I was worried about how I would pay the bill. That shouldn't happen to anyone in this country, one of the wealthiest countries in the world. And y'all, this pandemic has only amplified the urgency and the need for healthcare in this country for everyone, regardless of their zip code, regardless of their job, regardless of their bank account. More than 500,000 lives have been lost to COVID-19. And the heartbreaking reality is that it didn't have to be this bad. Millions have lost their jobs and their health insurance through no fault of their own. And we have a responsibility to ensure that everyone can get the care that they need. I see the pain being faced by too many families who are worried about loved ones in a hospital. Our seniors are struggling to pay the high cost of prescription drugs while living on a fixed income. And people are being forced to choose between paying for their care or paying for their bills. As a survivor of this pandemic and this virus, I remember worrying if I was going to live or die. I remember the struggle to recover from the lasting side effects for weeks. And I can't imagine the dual fear people might experience when deciding to seek the care they need in these uncertain times because of lack of health insurance. We have a responsibility to put systems in place to help people not only survive, but to thrive. The Medicare for All Act will guarantee that everyone has high quality health care in this country. I'm the voice for Georgia's 5th Congressional District, a district where nearly 100,000 people are uninsured, and that doesn't even count the underinsured. For decades, we've seen the disastrous outcomes in our most vulnerable communities from a lack of affordable health care, and it's time to put a stop to that. The Medicare for All Act does just that, and I urge my colleagues to support this bill because every single American, no matter their income, no matter their zip code, deserves high quality health care. And now it is my pleasure to turn it over to my colleague from the south of me, even though Georgia, you think we're already pretty south, but Florida's 22nd district is represented by my colleague, Congressman Ted Deutsch, and I'll turn it over to you.
Thanks so much, Nikema, and it's terrific to be with you. Thanks to Representative Jayapal, Representative Dingell, all of my colleagues who are here today. Thanks to Public Citizen and Social Security Works and National Nurses United. Thanks to Black Lives Matter and really the whole amazing roster of groups who are leading this effort today. And special thanks as well to the advocates all around the country who helped get us to this moment, especially those in South Florida in the 22nd District. And I would be remiss if I didn't take a moment to acknowledge our late dear friend, Mitch Stolberg, who showed up at every town hall meeting, always sitting in the front row, always with his Medicare for All sign. He unfortunately didn't live to see this moment, but we are all thinking about Mitch, and we're also grateful to him and his legacy and advocates all around the country. I'm so proud to join you today, along with over half the Democratic caucus, committed to making healthcare a human right in this country. Medicare for All means the end of seniors skipping the pharmacy so that they can buy groceries. It's the end of using the emergency room for basic health care. It's the end of giving up everything that you've worked for in your life to get nursing home care. And it's the end of copays, deductibles, and coinsurance that for too long have plunged even those fortunate enough to have coverage into bankruptcy. And within the next decade, those out-of-pocket costs are expected to eat up half of the average Social Security check. Now, we've made a lot of progress over the past decade. We made a lot of progress when we passed the Affordable Care Act over a decade ago, but we've seen what happens when we leave millions of Americans behind. When COVID-19 hit, it found too many Americans already sick, vulnerable, and without access to basic medical care. But the vulnerability wasn't shared equally among all Americans. Communities of color have disproportionate gaps in coverage and have borne a heavier toll from this virus. Before the pandemic, people without coverage would wait in emergency rooms to get basic care, but where were they supposed to go when the ER was crashed by COVID-19? What could I tell constituents panicked at the price of Cobra when they got laid off last spring? What could I tell Floridians who are working hard, scraping by, but who have been denied Medicaid expansion for over a decade? And what can I tell the middle class families who make too much to get subsidies, but not enough to afford coverage? Well, now I can tell them that we patched things up a bit with the American Rescue Plan, a big, bold, dramatic step. But we can't just patch our broken healthcare system in a crisis. Medicare for All, healthcare is a human right. That's how we truly fix it. I am honored to be with all of you today to fight for healthcare as a human right and to support Medicare for All. Thanks so much for letting me join you. And with that, I will turn it back to my good friend, Representative Jayapal. Thanks again, Pramila, for everything.
Thank you so much, Ted. And I hope everybody is just as fired up as I am after listening to our amazing colleagues, and what a diversity of colleagues. These are colleagues in frontline Trump districts. They're colleagues in states across the country, colleagues who are first time to Congress and happen to run the state party, Democratic State Party in Georgia. That's you, Nikema. And of course, champions who have been here and pushing for this. We had so many members of Congress who wanted to join us today to help launch the Medicare for All bill, and we couldn't get them all here to speak. It would have taken all day. But here's a quick video, a 6-minute video of some of them saying why they support Medicare for All.
I support Medicare for all because healthcare is a fundamental human right for all, not a privilege for some.
Nothing is more essential than being able to make sure that healthcare is available to our citizens. We have a plan. I look forward to making progress to make it a reality.
I support Medicare for all because no one in America should go bankrupt if, God forbid, them or a loved one gets sick.
I got involved in politics because I wanted the privilege at the end of my life to have put on my grave or urn or whatever that she helped get health care, affordable quality health care for every American as a right.
I support Medicare for all because health care should be a right and not just a privilege for those who can afford it.
I support Medicare for all because I'm a nurse who has seen patients die because they couldn't afford medication or treatment. Because last year, I was hospitalized with COVID-19 while uninsured and have the medical debt to prove it.
And I support Medicare for all because health care is a universal human right.
I support Medicare for all because I represent the third poorest congressional district in the country. And my neighbors are dying or getting sick because they don't have access to health care.
I support Medicare for all because everyone deserves dignity and security.
I support Medicare for all because healthcare is a human right, period.
I support Medicare for all because everyone should have the right to comprehensive and affordable health care, no matter where they live or work.
And I support Medicare for all because I've seen the misery that happens when people don't have access to health care.
I support Medicare for all because COVID-19 proved that everybody's health is connected to everybody else's health.
I support Medicare for all because health care should be a right and not a privilege.
Tens of millions of Americans have lost health insurance in the middle of the pandemic when they need it most. I support Medicare for all because health insurance should not be tied to one's employment.
I support Medicare for all because healthcare is a human right, and we need to do everything we can to make coverage universal, lower costs, and remove barriers to treatment. That's something all of us can agree on.
I support Medicare for all because healthcare is a human right.
Hey everybody, I ran for Congress because as a 2-time cancer survivor and a dad of 2 young adults with Crohn's disease, I know from personal experience that everybody needs access to great health care. And now look what we've been living through with this pandemic. It's shown that unless everybody has access to health care, it's a disaster. Let's pass Medicare for all. America deserves no less.
I support Medicare for all because health care is a human right.
Why do I support Medicare for all? Because the private health insurance profit machine is wasting billions in care. And all of that could and should be going towards saving lives, not lining corporate pockets.
I support Medicare for all because what we've learned from this crisis is that healthcare should be affordable and accessible for everyone, everywhere.
I support Medicare for all because in the wealthiest nation in the history of the world, you should not lose your healthcare simply because you've lost your job. We deserve a civilized society where your ability to get necessary medical care isn't determined by your wealth, your race, your gender, or your sexuality.
I support Medicare for all because when I was 7, I ended up in the hospital and we didn't have health insurance and I almost bankrupted my family.
I support Medicare for all because I believe that everyone should have access to health care.
I support Medicare for all because we live in the richest country in the history of the world, and healthcare ought to be a fundamental human right for everyone, not a special privilege for those who are well off and well connected.
I support Medicare for all because all Americans deserve access to long-term services and supports. It's time we help families focus on getting the care they need instead of worrying about how to pay for it.
And I support Medicare for all because I know what it's like to forego needed medical treatment because of a lack of health insurance.
I support Medicare for all because the only thing people in need of medical attention should worry about is healing, not bills.
I am here to tell you that I support Medicare for all. Everybody deserves health care. It is a right.
I support Medicare for all because, well, whenever anyone needs health care, they should have access to the health care that they need.
I support Medicare for all because I believe no one should have to decide between a place to sleep and food to eat or a hospital bill.
I support Medicare for all because it provides critical mental health services for everyone living in the United States, especially during this pandemic.
I support Medicare for all because no human being should ever be denied health care.
I support Medicare for all because no parent should have to choose between feeding their kid and health care. As a millennial, I want a better future for everyone.
In this pandemic, 15 million Americans have lost their private health insurance. 15 million Americans without health insurance at a time of a national healthcare crisis. That's appalling. If that doesn't teach us that we need to have Medicare for all, that every person should have health care from the day they are born, then I don't know what will.
The time is now.
And it is time.
It's time.
It is time.
It's time. It's time.
It's time for Medicare for all.
It's time for Medicare for all.
It's time for Medicare for all.
It's time for Medicare for all in America.
It's time for Medicare for all.
It's time for Medicare for all.
It is time for Medicare for all.
It's about damn time.
It's time for Medicare for all.
Wow. I'm an organizer at heart. And let me tell you, since I've come into Congress, this has been my passion, is organizing around Medicare for all. And you see what amazing colleagues we have, and the stories that they have to tell mirror the stories of the American people. And so now it is a real privilege to be on this call with so many organizations that are doing the grassroots organizing outside of Congress that is driving this movement. And so let me start by introducing a fearless champion of Medicare for All, Bonnie Castillo, Executive Director of National Nurses United, the largest nurses professional organization and union in the country, with more than 150,000 members nationwide who have been taking care of our country on the front lines. Bonnie was also named 2020's Time 100 Most Influential People in the World. Bonnie, over to you.
Good afternoon, and thank you, Representatives Jayapal and Dingell, for inviting me to speak today. For more than a year, nurses have been caring for patients in the midst of COVID-19. This pandemic has laid bare the flaws of our for-profit healthcare system. Those flaws result in deaths. Our current system values profits more than life, leaving our country unable to adequately respond to COVID-19. It has never been made more clear that our country must transition to a Medicare for all system that would guarantee health care for every person living in the United States. Nurses see countless conditions that could have been prevented if patients had primary care. We see patients unable to afford life-saving treatment, and insurance companies refuse to cover critical procedures. The current system was a disaster before the pandemic, and it has just gotten worse during COVID. Over the past year, tens of millions of people in America lost their jobs and their employer-sponsored health insurance. People with COVID and many other illnesses who lost jobs or who couldn't afford co-pays, premiums, and deductibles, even with insurance, often waited too long to seek care. We have lost more than 530,000 people to COVID-19. If we had had Medicare for all before this pandemic, many of those people would be alive today. COVID vaccines are free to everyone at the point of service, with no billing, no insurance company middlemen, co-pays or deductibles. That same principle should apply to every other illness. We must guarantee health care as a human right with Medicare for all. National Nurses United is proud to endorse this bill, and we look forward to working with all of you to make this happen. Thank you.
Thank you, Bonnie. And now it is my honor to introduce Phil Okato, who is our Revolution member from Maryland, who is a community activist, but he has a very personal story to share with us. Phil?
Thanks, Representative Dingell. Hi, everyone. My name is Phil Okato, and I'm a community activist and member of Our Revolution Maryland. I live in Annapolis, Maryland with my wife, and I work as a professional good troublemaker for the Backbone campaign. Greetings, Representative Jayapal from your friends on Vashon Island. In 2010, I was diagnosed with multiple myeloma, an incurable form of blood cancer that affects the bone marrow. When I was diagnosed, I was a healthy 30-something guy who went to the gym and ate right. Today, after 11 years with this disease, I'm still fighting for my life. But my fiercest battle hasn't been with my cancer, it's been with my health insurance company. Last year, I had a months-long battle to get the drug I'm currently on, where my doctor's team had to go to great lengths, and I had to mobilize my community in order to pressure the insurance company to approve coverage. This drug ended up working far better than expected, and my cancer went into remission for the first time ever. When it came time to renew my prescription this year, the insurance company told me that the drug I need to stay alive isn't medically necessary and denied it. After several rounds of appeals, they finally approved it, but would not pay for it. And I was looking at a bill of about $23,000 a month, or around $276,000 a year to pay for my medication. After more appeals and almost 2 stressful months without the drug, when my body went into a steep decline, last week we finally got the insurance company to do what it's supposed to do: pay for the medication I need to stay alive. Unfortunately, my story isn't unusual. Too many people like me are sick and dying and denied care because of a healthcare system that makes decisions based on what saves money instead of what saves lives. How many more of us will they sacrifice to maintain their bottom line? What will it take to create a healthcare system that puts people first? I'm here today because my life's on the line, and I'll keep fighting alongside you all until we are all guaranteed we will get the life-saving care that is our right as human beings. We can build a healthcare system in this country that actually prioritizes health. It's called Medicare for All, and it's well past time to make it the law of the land. Let's do it.
Phil, thank you so much for sharing your story and for doing the work on the ground to make this happen. We are so committed and so grateful to people like you across this country. I am so excited to introduce our next speaker, Dr. Eric Dixon. Dr. Dixon is the president and CEO of UMass Memorial Hospital, the second largest healthcare system in Massachusetts. And Dr. Dixon has been on the front lines leading his system of hospitals and patients to safety during the COVID-19 pandemic. And we're very grateful and thankful to hear from you today. Dr. Dixon, over to you.
Thank you. And thank you to all my colleagues for allowing me the opportunity to speak. My name is Eric Dixon. I'm the president and CEO of UMass Memorial Healthcare, and I'm a practicing emergency physician. And I support Medicare for All because it can address 3 of the biggest problems we have in healthcare. First, healthcare in the United States is inequitable. The quality of the care that you get depends on the insurance card you're carrying in your wallet, if you have an insurance card. People that are living in poverty and are on Medicaid have poor access to care because the providers don't want to take a rate that is significantly less than the cost of care. They'd much rather take care of a person with commercial insurance that pays twice as much as Medicaid. And they certainly don't want to take care of people that are uninsured and have a limited ability to pay. I have seen over and over again in my career people not able to take the medications I prescribe for them or get the diagnostic tests they need because of they couldn't afford the care. We can have no quality health care in this country if we don't have equity. Medicare for All can create a much more equitable system. The second problem we have to address is the cost of healthcare in the United States. The cost of healthcare in the United States is twice as much as other like wealthy nations because of the administrative burden that is put on healthcare through hundreds of insurance companies with hundreds of different rates to thousands of different providers. There is thousands of people that do nothing but create administrative burden for providers through pre-authorization processes, denials or claims that then force the providers to go back and redocument and resubmit complaints. This is 20 to 25% of the cost of healthcare in the United States. We need to take that 25% out, and we need to use it to expand coverage and to invest in other important initiatives for this country. It should not be buried in an administrative burden. The third thing that we have to deal with in the United States is clinician burnout, which is happening at a horrendous rate, especially post-COVID. And the number one thing that burns out a physician is the administrative burden of filling out pre-authorizations, excessive documentations required, the fights with the insurance companies to get people like Philip the drugs they needed to get better. This is not what a physician should be doing with their time. We want to be taking care of patients. And it is the administrative burden that is put on us from the insurance companies that often prevents us from being able to do with that. Medicare for All can deal with all three of those issues and create a more equitable, less costly healthcare system that can retain caregivers for a longer period of time if we can get them back to taking care of patients. And that's why I support Medicare for All.
Thank you, Dr. Dixon. It's really important to hear from a physician like you, who's also a hospital administrator, about how this helps everybody. I would now like to introduce Nancy Altman, one of our country's foremost experts on Social Security and pensions. She is president of our partner organization, Social Security Works, and also serves as an appointee on the 7-person bipartisan Social Security Advisory Board. She has been very active in this fight, and it's an honor and a privilege to introduce Nancy. Thank you, Nancy.
Thank you so much. The Medicare for All Act of 2021 is a win for seniors. Take the case of Leon Letterman, a Nobel Prize laureate. He was forced to sell his medal to pay for long-term care. Medicare for All would cover all long-term care, including home and community-based care. That means tens of millions of seniors and people with disabilities would no longer have to impoverish themselves to get the care they need. Moreover, the Medicare for All Act adds hearing, dental, and vision coverage. The inability to see and hear increases the risk of falling. Hearing loss is isolating and substantially increases depression and dementia. Untreated dental problems can lead to malnutrition and can result in heart and lung disease. All of these crucial benefits, vision, hearing, dental, and long-term care, are provided under the Medicare for All Act. And the legislation eliminates every penny in premiums, copays, and deductibles. With Medicare for All, healthcare costs will no longer consume over 40% of the average Social Security benefit. COVID has shined a bright spotlight on the need for Medicare for All. 95% of Americans who died of COVID were over the age of 50. Medicare for All would have saved many of those lives. Importantly, by expanding Medicare to all, Medicare will be even more efficient, secure, and reliable. And expanding it to cover everyone will make it politically stronger as well. For all these reasons, Social Security Works strongly endorses this important legislation. We are so grateful to Representatives Jayapal, Dingell, and all the co-sponsors for their vision and wisdom. Thank you.
Thank you so much, Nancy, for your leadership and for your partnership in moving this forward. And now it is a real pleasure to introduce another transformative leader who has been part of our coalition at the very center of it all, the president of Public Citizen, Robert Weissman. Rob is a staunch public interest advocate and activist, a movement builder, and an expert on corporate and government accountability, prescription drug pricing, and access to the courts.
Thanks so much, Representative Jayapal, and to you and Representative Dingell, all the co-sponsors for We're so appreciative of your leadership on this and to the colleague organizations who are driving this fight, same thing. This is an exciting moment, and this town hall, this conversation, seeing that video, man, I'm feeling charged up, and we need to be charged up at this time. I'm just struck, and listening to the stories, and Phil, hearing your compelling, terrible, compelling story. The thing that defines our current system is the thing that is used to criticize Medicare for all. The current system is based on rationing, right? We're the richest country in the world, but we don't make care available to everybody. We ration it out, we restrict it. You can't get access to care if you're not insured. It's rationed. If you are insured, you still get care rationed because the insurance companies, as Phil shows, won't give you what you need. You can have insurance, but you don't get coverage, as Nancy said, for all the things that you need, whether it's dental or hearing or eye care, and especially long-term care. Everybody's got to deal with outrageous drug prices, which generally aren't covered. And 3 in 10 Americans don't fill their prescriptions or don't take them on time because of concern with cost. That's the cruelty of our current system. And if we had any doubt, that system was tested under the worst acute public health emergency of the last 100 years with this pandemic, and it's failed miserably. When people needed care, they were dropped from care. They lost their health insurance as they lost their jobs. The health insurance companies were thrilled because they made more money amidst this public health crisis. Hospitals hadn't made the right kind of investments because our system incentivizes the wrong things, and they weren't prepared for the moment. The existing inequities, racial and other inequities in the system were compounded at this moment when the healthcare system should have been uplifting people, righting inequalities. So if there's been any doubt ever about the need for Medicare for all, that is long gone. We need to face the reality. There is only one reason we don't have Medicare for all right now, and that is the political opposition and the lack of political will. But what has me so excited today is feeling the energy in this conversation, knowing about the movement that's growing across the country. I am confident we are going to overcome the obstacle of the health insurance business, the health insurance corporations, the ideological opponents of Medicare for all. We've been tested. This system has been tested and it failed. And now we're being tested and we have to succeed. And I'm confident we're going to do that with this great coalition and building and expanding it, and soon win passage of Medicare for all. Thank you so much.
Rob, thanks for all you do for so many. You just make a difference every day in people's lives. Unions have been a very important part of this fight because they want all Americans to have access to health care. So I am very pleased to introduce Mark Diamonstein, who's president of the American Postal Workers Union, which represents more than 200 employees in the U.S. Postal Service and approximately 1,500 employees in the private sector mailing industry. Mark?
Thank you so much, Congresswoman. Thank you and Congresswoman Jayapal for your tremendous leadership. And the American Postal Workers, just a quick correction, 200,000 workers that we represent, is very proud to join with all of you in supporting Medicare for all, universal health care for everyone. The pandemic crisis gives us new opportunities to win the world we want and need. It has graphically underscored the need for health care as a human right. With health care coverage largely tied to employment, millions of workers lost their health care coverage overnight. Lack of access to good and quality health care for millions more led to more sickness and death. And yet, if we had cradle to grave, societal-based health care coverage with everyone in and nobody out, individuals and our society, for all of us and as a whole, would be much healthier. Most of the workers we represent currently have employer-based health insurance. However, we are paying ever higher costs and receiving fewer benefits, with our members now saddled with over $6,000 a year just in family coverage premium costs, even without calculating co-pays, deductibles, and other expenses. Even those of us currently with employer-based medical health care coverage, we would be far better off in terms of costs and coverage under a single payer Medicare for All system. Taking the ever-rising healthcare costs off the bargaining table when unions and management engage in negotiations would be a huge step forward for the workers we represent and our families. Postal workers are extremely proud to be part of the public good. Yet there is no greater public good than our health. It is high time we put healthcare as a human right over the profits of the medical industrial complex. Medicare for All is proven, simple, cost-effective, fair, and just. And we look forward to working with all of you to make it a reality. Thank you.
President Dimmonstein, thank you so much for those fabulous words, your support, and all the work you do on behalf of postal workers in our country. We have the biggest labor coalition ever. We have 15 international unions that have endorsed. We've got another 10 local unions across the country, and we intend to continue to build that. With that, let me turn to another big area of coalition that has emerged over the last 2 years, and that is from the business sector. I'm really proud to introduce Jacob McKean, who is the founder and CEO of Modern Times Beer, a craft brewery based in San Diego with 300 employees at 7 locations on the West Coast, and is also a member of Business Leaders for Healthcare Transformation. Jacob, thank you so much for joining us.
Thank you so much for having me. I'm proud to be here to make the business case for Medicare for All. As the founder and CEO of a growing business, I've had to deal with privatized healthcare every step of the way. When I first decided to start my business, the first thing I had to do was take the terrifying step of giving up my own health insurance when I left my last job in order to dedicate myself to getting my company off the ground. It is absurd, inefficient, and immoral that this country forces entrepreneurs to take such a dangerous risk. It is a huge deterrent to starting a business and a serious drag on American innovation. When I opened the doors to my business, I had to navigate the immense difficulty and expense of buying health insurance for a small startup. There's no reason why early stage companies should be burdened with this unnecessary task. It costs time, energy, and money that could be better spent on wages, growth, and innovation. As my company has grown, I've had to cope with the absurd costs and complexities of providing health insurance to hundreds of people across multiple states. And to what end? We force American businesses to cope with the burdens of privatized health insurance simply to protect the profits of a tiny handful of health insurance executives. It does nothing to promote American innovation or competitiveness. In fact, it makes it harder for us to compete against businesses in countries that do offer universal health care. The COVID-19 crisis has laid bare all the ways in which our fragmented, profit-driven healthcare system has failed us. What was a grinding, ongoing nightmare before COVID-19 is now a full-blown daily crisis for employees and employers alike. As millions of workers have been laid off across the country in the face of the pandemic, it should be crystal clear to lawmakers that continuing to tie healthcare to employment is an awful system. We have been forced to pick between the risk of exposing ourselves and our employees to COVID or cutting off everyone's healthcare coverage. The only way to resolve this cruel and unnecessary moral dilemma is by passing Medicare for All. And really, we needed it yesterday, which is why I named a beer, Medicare for All, yesterday. As the owner of a craft brewery and coffee roasting company, I can only ensure my 300 employees have healthcare if I can continue to pay them. During the pandemic, I was forced to furlough 55 people because of mandatory shutdowns. My company voluntarily paid for their health insurance, but not every company could afford to make that choice. That is a catastrophe. It is long past time we do away with employer-sponsored health insurance. It's a failed system with flaws so obvious and fatal, it's remarkable we've tolerated it as long as we have. We must replace it with Medicare for All immediately. Thank you.
Thank you, Jacob. I don't drink, but a Medicare for All beer might just get me to do it. So thank you for that. And a lot of my colleagues would pay to see me have a drink because, so thank you. That really, I don't know why, but that's making my St. Patty's Day. But another important partner has been local governments, state and local governments. And it's now my honor to introduce Council Member Amelia Parker, who has served on the Knoxville, Tennessee City Council since 2019 and championed a successful resolution in support of Medicare for All that passed overwhelmingly by the City Council in May of last year. Amelia?
Thank you so much, Representative Dingell, and to all of the other members of Congress who have joined us today and who are championing Medicare for all. We truly need it. Local governments truly need it. What we're seeing in Tennessee, due to a lack of healthcare coverage for all in our state, is local rural hospitals shutting down. And this has caused our emergency rooms in cities to be more overwhelmed. It has impacted our local municipal budgets. And because of this, we are seeing more and more individuals throughout the state understanding the need for Medicare for all and calling for it. Even though, like others who are located in red states, we do not have leadership on a state level that support this. But through passing resolutions on a city level, we can represent the voices of the thousands of individuals throughout our country, not just on the East Coast and the West Coast, but also in red states, who support Medicare for all and see the desperate need for it. So I am honored to join this fight for Medicare for all, to be in this fight with you all, and to encourage other local representatives and local governments throughout the country to take this on, to lift up the voices of those you represent, and show that there is support throughout this country for Medicare for all. I believe we can get this passed, and I am excited to work with you all on achieving that. Thank you all so much.
Amelia, thank you so much for your leadership and just for the inspiration for city resolutions passing across the country. And next, we have our final speaker of today is a transformational leader on bringing a real conversation on race, racism, and anti-Blackness. Patrisse Cullors is the co-founder of the Black Lives Matter Global Network and founder of the grassroots Los Angeles-based organization, Dignity and Power Now. Patrisse, we are so grateful to you for your incredible leadership, and we welcome you here today.
Thank you, Representative Jayapal, and also thank you, Representative Dingell, for continuing the fight for Medicare for all. I'm very grateful to be in this conversation, really moved by everybody's both storytelling, but also urgent call to action. So many of us know the legacy of Medicare as one of the largest expansions of healthcare in our country's history. But what many folks don't know is how Medicare was a tool for racial justice in the 60s. By conditioning federal funding for hospitals on integration, it desegregated hospitals across the country almost overnight. With Medicare for all, we can move closer to racial justice in healthcare. Racism is a public health crisis. So many of you know the statistics. Black, brown, and Indigenous folks often face the worst health outcomes. Our communities have the highest uninsured rates. Police and state-sanctioned violence brutalize Black and brown bodies and take years of our lives. COVID-19 has only made these disparities worse. We need solutions that are holistic. We need solutions that center prevention, solutions that create health and safety by investing in people and communities, solutions that don't just help us survive, but create the conditions for us to thrive. Medicare for all is that kind of solution, but it's just the start. As a Black woman and a mom, I lived health inequity. I've had my concerns ignored and my pain mismanaged while giving birth. Medicare for all won't fix it all. More access isn't a cure-all. We actually need to root out white supremacy through our delivery of care. We need health justice. From the safety of our neighborhoods, to the quality of our water, to the support we get from our government to raise our kids, all these things affect our health. We need big, bold, intersectional solutions like the Breathe Act. If we truly want to invest in our collective safety and well-being and root out racist health inequities. Today, with Medicare for All, let us take this first step together. And it's an honor to be on this journey with you. Thank you so much.
Patrisse, thank you for all that you're doing. And I just want to say thank you to Pramila for being my partner, for just all the work we've done together and are going to do work do together. And to all of you that have been on with us today, we've been on a journey and we're going to complete this journey together. So thank you for all that you've done. And the time for Medicare for All is now. And with that, I'm turning it back to Pramila.
Debbie, thank you so much. And thank you to our incredible, powerful speakers. And let me tell you, there's a couple thousand people watching this live. And they've stayed with us, if you can believe it, through this entire hour and 15 minutes, because this issue is so important. And I'm an organizer. That's my heart and soul. And I can tell you that strength comes in times of crisis. We have the crises in front of us, and the strength has emerged. It is continuing to emerge. And our ultimate success will come from that grassroots organizing outside of Congress and the organizing we do inside of Congress. We are the richest and most powerful nation in the world. And I know that we can pass, and we will pass, Medicare for All. So I want to thank everybody so much. As you check out here, there's a fabulous video from a number of groups across the country talking about Medicare for All. And stay tuned. Our movement is strong and growing. Thank you all so much.
The time is now for Medicare for All. Our families can't wait. We deserve a healthcare system that is rooted in caring for our people in our moments of crisis, not rooted in the profits of corporate executives. We deserve a system of healthcare where everyone, no matter your background, your race, the zip code you were born into, where everyone is in and no one is out.
We wouldn't have to worry that, his death meant financial ruin for us. It's a selfish thought to think of what's going to happen when he does. You just want to be with them. You want to experience your last moments of not have to worry about that and actually properly grieve someone.
I've been disabled for over 20 years. I was in an accident when I was 12 years old, and the medical costs and care for myself after the accident nearly bankrupt my family.
I have seen firsthand what COVID has done to the world, yes, but to our country most of all. So many people have died, and they've died needlessly.
Medicare for All is important for our community because it would help prevent and end homelessness, because poor health is a leading cause of poverty and homelessness. It would benefit patients experiencing homelessness by allowing them to prioritize their own health over their ability to pay.
Hi, my name's Colin, and I have severe hemophilia, which requires me to give myself an IV in the arm every other day just to live a normal life. I'm incredibly grateful for my medication because it's given me a chance to get an education, move across the country, and to just be an active person, which is something that older hemophiliacs never got a chance to do. I turned 26 this year, and I'm going to fall off my health insurance at the exact same time that I graduate from my master's program.
As someone on the front lines, as an activist and a nurse, I ran for legislator because I've seen firsthand over the decades what happens when people can't access healthcare. I remember a very young man, who died of septic shock from an infection. And if he had felt that he could afford going to a provider in time, it would have saved his life.
And we want Medicare for All because why?
Because we believe healthcare is a human right.
Why, Summit?
Because everyone deserves healthcare.
Why, Jeanette?
Because we know from the examples of countries around the world that we can afford better healthcare and we can afford it for everyone through Medicare for All.
Everybody in, nobody out.
First, I would like to do a show and tell and show some medication. The medication you're looking at or did look at is how much medication I now take every day. And it's the amount of medication that I've been taking maybe for 30 years. And so basically medication and my health has been suffered economical oppression for that amount of time.
If we learn nothing else from the current health crisis, I hope the least thing that we can realize is that Medicare for all is something that's necessary. It should be already done. How many more lives, how many more people are we going to lose?
I have been a nurse for over 4 decades. COVID-19 created a public health crisis, but people in our country have been living in a public health crisis for decades because of our broken healthcare system. COVID-19 has intensified racial inequalities and highlighted the long systemic racism embedded in our healthcare system. Medicare for All will cover everybody with comprehensive, high-quality care, ensuring anyone who gets sick can see a doctor.
And over 25 years ago, my son was born uninsurable with severe hemophilia A. It's a genetic bleeding disorder. And every other day we set up an IV and we give him clotting factor, which is $1,000 a dose every other day, costs $30,000 a month and over $350,000 a year.
And I have a $2,777 bill from the hospital only, because my doctor kept sending me back. I finally tested positive for coronavirus.
I qualified for Medicaid, which allowed me to begin a new journey in life as a paraplegic. But I knew it would require immense focus, discipline, and patience. If it weren't for Medicaid, I would have had to start over with a hospital bill of $750,000. However, after 2 years, Medicaid money dried up and I had to navigate applying for Medicare. It was a scary time. For 6 months, I was newly disabled, unemployable, and broke.
I have seen too many times patients present late in their course because they have not been able to access care. I have seen patients go undiagnosed and then become unable to be adequately treated because they could not access care earlier.
50 years ago, the Reverend Dr. Martin Luther King said, "Of all the forms of injustice, inequality in healthcare is the most inhumane."
My husband and I decided we wanted to have a child, and so I got pregnant. And right around that time, I was planning on going to graduate school. We were buying a home in Northern Virginia. We were just the typical family. Around 24 weeks, I was diagnosed with early onset preeclampsia and hospitalized. The day I reached 26 weeks, my baby had to be delivered because we were both dying. When she was born, she weighed 1 pound, 11 ounces and was the size of my hand. She was in the NICU for 3 months, and at the time I didn't think a whole lot about healthcare expenses because I thought we had good insurance.
The broken healthcare system has impacted me by giving me a medicine that costs $146,000 a year.
And back in 2004, I was 26 and I was diagnosed with a stage 4 breast cancer. So I am not supposed to be here right now. And in the middle of my treatments, I had to reapply for main care because you have to reapply yearly. So in the middle of my treatments, I tried to reapply and they gave me every excuse in the book as to why I could not have any type of health care.
We can and we must build a healthcare system that works for people, all people, and is strong enough to weather the storm of a national health crisis. COVID-19 has taught us that the only way forward is together. To keep everyone safe, healthy, and free, we can and we must ensure healthcare for all of us. It's time for Medicare for all.
Shouldn't have been this way. I shouldn't have had to pay everything into the healthcare system for my child to survive. And winning Medicare for all is so incredibly important to me.
Now more than ever, it's time for Medicare for all.
We need Medicare for all now. Already in my short career, I have seen patients die because of lack of access to affordable medical care.
It's time for Medicare for all.
And right now, it is the time to expand and improve Medicare with Medicare for All.
We do need Medicare for all.